Hello class, I wanted to go over my presentation about a client that I saw in the clinic yesterday. So the patient ID, the initials are EY, the child is 10 years old, he is male, and date of birth is in 2014. He is Caucasian and a mixture of ethnicities, and he was accompanied by his mother. The mother and patient were reliable historians, and he is an established patient with the clinic. And his chief complaint was, "My right ear hurts." So Ethan, a 10-year-old male with a history of peanut allergies, he was brought by his mother with the complaints of right ear pain. The mother states that he complained of the pain 2 days ago, only on the one side, the right side. The pain is constant. They characterized it as sharp, 7 out of 10. There was slight relief with ibuprofen. The mother also said that he did have a fever last night of 101. The mother says that he has not swam recently and that he denies any objects in the ear. His past medical history, he has none. He has no surgical history. The only hospitalization was from the anaphylaxis from the peanut allergy, and he has no other known allergies to medications, drugs, or the environment. He is on no medications. He just has the EpiPen for the peanut allergies. And his immunizations are all up to date. His physical was a month ago. His family history doesn't necessarily apply to the case, but his mother has a history of migraines and his father has a history of hypertension and hyperlipidemia. The mother is a stay-at-home mom, the father works full-time as an engineer, and the boy is in 4th grade, but he stayed home from school yesterday because of the pain. And the review of systems, the mother states that he did have the fever, but they both deny any unintentional weight gain or loss or fatigue. The patient denies any changes in his vision, no blurred vision, no floaters or pain in his eyes. As for his ear, he does state pain, but there's no discharge. There's no sinus pressure, sore throat, runny nose, tooth pain, trouble swallowing. And for his cardiovascular, he denies any chest pain, palpitations, any fluttering. Respiratory-wise, denies any shortness of breath, no cough, no wheezing. They also denied abdominal pain, nausea, vomiting, diarrhea, constipation. I was looking for all signs of sickness. And then neuro-wise, the patient and the mother deny any dizziness, seizures, numbness, tingling, changes in gait or weakness. So his vitals were, temperature was 101.3, so still febrile. Everything else was within normal limits. His heart rate was 68 beats per minute, respiratory rate 18, 99% O2 sat, and he's a normal height and weight for his age, 55 inches at the 57th percentile, and his weight is 80 pounds, which is 74th percentile. So upon physical examination, he is ANO times 4. He is sitting on the exam table. You can tell he's somewhat uncomfortable with his right ear pain, but he is well nourished and he's wearing appropriate clothing for the weather and hygiene. His conjunctiva are clear, sclera is white, there's no exudate, and upon examination of the ears, his right ear is tender upon palpation. The tympanic membrane is erythematous, bulging, and cloudy upon otoscopic examination. The left ear is non-tender, and the left tympanic membrane is non-bulging. It's clear and it has normal landmarks. His hair is intact bilaterally. The nasal mucosa is pink. Nares was patent. His oral mucosa was pink. The pharynx wasn't swollen. There was no exudate. Chest was symmetrical. No lifts, heaves, or thrills. Regular heart rate and rhythm. S1, S2 heard. No gallops, no murmurs. He was in no respiratory distress. His all lung sounds were clear and no wheezing, stridor. And then abdominal, no masses, no peristalsis. Normal active bowel sounds heard. No pain or masses felt. And his speech was clear, sensation is intact, cranial nerves intact. So my 3 diagnoses are acute otitis media, acute otitis externa, and mastoiditis. The final diagnosis was acute otitis media because it is characterized by sudden ear pain, tympanic membrane bulging, and erythema accompanied by ear pain. Acute otitis externa was thought because of the tenderness upon palpation, but he has no history of swimming and he does have the bulging tympanic membrane. Mastoiditis does have symptoms of like fever and tympanic membrane bulging, but it also typically is accompanied by pus, So that was rolled out. So acute otitis media, we're going to prescribe 90 milligram per kilogram per day of amoxicillin for 10 days. We should make sure the child takes it for all 10 days without stopping for when he feels better. And popping in the ears can be normal with the healing process, and he's able to go back to school when he feels better. We'll follow up in 1 month if the symptoms resolve, and we'll just check for persistent otitis media. Thank you for listening.